Theory of Goal Attainment by Imogene King. The theory of goal attainment defines nursing as action, reaction, and interaction by which nurse and patient share information about their perception in a nursing situation. The four elements that facilitate goal attainment are as follows. Health is attained through appropriate nurse and patient relationship. The nurse and patient need to have a mutual understanding of each other. The goal and function of nurse and patient need to be in line with each other. Nurse also need to use all his or her knowledge to establish a relationship and set goals. The domain of the nurse includes promoting, maintaining, and restoring health, and caring for the sick, injured, and dying. The function of a professional nurse is to interpret information in the nursing process, that is to plan, implement, and evaluate nursing care.
Welcome to Texas to Brazil, Mr. and Mrs. Diaz.
Mr. Diaz and his wife were celebrating their anniversary at a restaurant that serves all-you-can-eat meat. Minutes into the dinner, Mr. Diaz started to complain of headache, blurry vision, and chest tightness. The receptionist dialed 911 and Mr. Diaz was rushed to the nearest hospital.
Mr. Diaz is a 52-year-old Hispanic male, with a blood pressure of 190/105. A heart rate of 100 beats per minute, respiration of 20, temperature of 98.6, oxygen of 97%. He complained of headache, blurry vision and chest tightness while having dinner in a neat all-you-can restaurant.
The nurse started hooking up Mr. Diaz on the BP machine. She also lifted his shirt without saying anything and placed the electrodes on his chest. The laboratory technician suddenly came in and placed the tourniquet on Mr. Diaz's right arm and started to draw blood. Then, another nurse came in.
Here, take these medicines.
Mr. Diaz felt confused and violated. Nursing theorist Imogene King suddenly appeared.
Stop. That's not how it's supposed to be done.
Hi Mr. Diaz, my name is April, I'm your nurse, and I will be assisting you today. Could you please tell me what happened?
My wife and I were out celebrating our anniversary at Texas de Brazil when suddenly my head started hurting. My vision got blurry, and I felt tightness on my chest.
I see. I will now check your blood pressure Mr. Diaz. Please lay down in the examination bed for the next procedure. Thank you. I will be putting these stickers called electrodes on your chest so we can check your heart and a laboratory technician will come to draw blood from you. While I'm doing this, could you please tell me about your medical history? Is that okay?
Okay. I have hypertension, high cholesterol, and diabetes. I am supposed to be taking medications, but I forget to take it most of the time. I have not seen my doctor for 2 years because I am always busy for work.
Did you take any medications today?
No, I did not. I ran out of some medications and especially the one for the blood pressure. I tend to forget to follow up with my doctor to renew my script.
Do you smoke or drink alcohol?
I smoke a pack of cigarettes a day and occasionally drinks alcohol with friends.
Your blood pressure right now is 174/89, and your heart rate was 88 beats per minute. And your EKG shows normal sinus rhythm, meaning your heart is functioning normal as of this reading. Are you still having headache, blurry vision, and chest pain?
Just a little.
Okay, let me get the physician to come and see you. I will be right back.
Hello Mr. Diaz, my name is Rachel, I'm a laboratory technician. I will be drawing blood from your arm, is that okay?
Okay.
You seem nervous, Is it your first time in the ER?
Yes.
I see. It's normal to feel nervous, especially when you land at the emergency room for the first time, unexpectedly. But we are here to help you.
Thank you for your reassurance.
I've collected your blood sample and will be taking this to the laboratory. Is there anything you need before I go?
I'm okay for now, thank you.
A few moments later.
Hi, Mr. Diaz. My name is Dr. Thomas. Your nurse, April, has informed me of your condition. I will be giving you a medication to help lower your blood pressure and stabilize it. I am still waiting on your blood test results and will be informing you once I have the results.
A few moments later, Mrs. Diaz arrives at the ER.
Hi. My name is Dr. Thomas. What is your relationship with Mr. Diaz?
I am his wife.
Nice to meet you, Mrs. Diaz. Mr. Diaz, your blood pressure is now 130/80. And your heart rate is 68 beats per minute. How are you feeling now?
I'm feeling a lot better.
I'm glad to hear that. I got the lab results back and would like to discuss it with you. Would you like your wife to stay and listen to the conversation?
Yes, that is okay.
Great. Your lab results show a cholesterol level of 260, triglyceride level of 204, HDL of 38, LDL of 160, and hemoglobin A1C of 7.5. I will be sending you home with the following medications: metformin 1000 mg twice daily, amlodipine 10 mg daily, atorvastatin 20 mg daily, and Vascepa 1 gram 2 capsules twice daily. Nurse April will be coming shortly to reinforce the discharge instructions to you and your wife and to educate you on what to do to avoid hypertensive crisis in the future. Okay?
Okay. Thank you, Dr. Thomas.
Hello, Mr. and Mrs. Diaz. Here is your discharge paper. There are a few things we would like to remind you before you go to avoid hypertensive crisis in the future.
Okay.
Dr. Thomas have discussed to you the result of your recent blood workup. Your numbers are not critical. However, they are not at goal or at the normal range at this time. It is important for you and your PCP to monitor your lab values regularly and ensure you adhere to your medication regimen to avoid any adverse event. For hypertension, you need to limit your sodium intake to at least 1.5 gram per day. Sodium, also known as salt, comes in different forms from the food that we eat, not just from table salt. Canned goods, processed food, TV dinners, food that is so much seasoning has a high sodium content in it. Sodium in our blood attracts water. High sodium equals high water reabsorption, leads to high blood volume, that will bring high pressure in our blood. Also, to help control your cholesterol level, you need to limit or avoid intake of high cholesterol foods such as fatty beef, lamb, pork, fried greasy food, poultry with skin, lard, butter, shortening, dairy products made from whole or reduced fat milk. Uncontrolled high cholesterol in your blood can lead to hardening of your arteries or plaque buildup that can lead to stroke or heart attack. For your diabetes, you need to incorporate a well-balanced diet, carb counting, regular daily exercise and adhering to your medication regimen. By avoiding these foods, you'll be able to help lower down your circulating total cholesterol and your bad cholesterol. Overall, you need to set a healthcare goal for yourself and put in the effort to modify your lifestyle. Be mindful of your food consumption, increase fruits, vegetables and fiber in your diet, practice portion control, 90 to 120 minutes per week of aerobic exercise. Take your medications as directed even if you feel better, and stress reduction or coping mechanism is also important. Please also consider cutting back on your cigarette smoking, until you'll be able to finally get off of it. There are so many risks and organ damages associated with tobacco use. It increases your risk for stroke, blindness, gum infection, heart disease, hardening of your arteries, lung problems and many more. If you are interested on nicotine replacement, follow up with your PCP. For the meantime, I can give you this brochure for smoking cessation. You would need to follow up with your primary care provider within a week from today. For any sudden change in your condition that requires immediate medical intervention, such as palpitation, chest pain and tightness, shortness of breath, difficulty of breathing, headache, and vision change or change of mental status, call 911, or go to the nearest hospital. Mrs. Diaz, your part is very important in helping Mr. Diaz achieve these goals. Mr. and Mrs. Diaz, were you able to fully understand these teachings? Do you have any clarification?
Yes, I fully understood it. I never really knew the role of each of these things to one another and the effects of poor food choices, daily habits. Being inconsistent and not really taking my health seriously can put me in trouble. I am grateful you took the time to explain all these to me and to my wife. I think with better understanding, we will be able to understand the importance of the why we have to do this, and why we have to avoid that. Thank you so much for your help.
I don't have any question. Your instructions are all clear to me. I will make sure on this day forward, I will remind him to take his daily medications, be mindful of what we eat, and to follow up with his primary care provider. Implementing the interpersonal system in EDs would not only augment efficacy but also improve patient satisfaction and perception of the quality of care. Transactions between caregivers and patients could be done and mutual goals set. The method of attaining the goals could be discussed between the patient, the nurses, and other care providers.
It is evident that overcrowding and ineffectiveness in EDs negatively affect the patient's perception and consequently impede optimal satisfaction. However, applying the key concepts of the theory of goal attainment, which emphasizes clinician-patient and nurse-patient relationships, could positively enhance efficacy in EDs and, therefore, improve patients' perceptions of the quality of care. Patient-centered communication techniques could be adopted. Communication on the health status, medication treatment, and any other issue, including possible delays, should be made promptly and constantly to the client. Communication can be enhanced by providing mechanisms that allow both formal and informal communication and that let the patients express themselves freely. Communication can be enhanced through training of nurses and other stakeholders on good communication skills. It is worth noting that good communication has been linked to augmented satisfaction and positive perception of the quality. Patient satisfaction is a key aspect in care delivery. Optimal satisfaction is linked to positive outcomes and positive perception of the quality of care. Therefore, it is imperative to understand what drives patient satisfaction and what measures a customer uses to weigh the quality of care. Future research, therefore, should focus on other key drivers of patient satisfaction and expectations on EDs. As such, researchers should consider finding out more drivers to satisfaction and ways to address them and augment satisfaction and outcomes in EDs and healthcare in general. King used a method of non-participant observation to collect information about nurse-patient interactions on a patient care unit in a hospital setting, with patients and nurses volunteering to participate in the study. King trained graduate students in NO. She examined multiple interactions and recorded verbal and nonverbal behaviors data. King further tested her criterion reference measure of goal attainment tool, a measure of functional abilities and goal attainment for assessing functional abilities of patients in making decisions about goal setting with and for patients to measure goal attainment. Nursing is an observable behavior found in the healthcare systems in society. The goal of nursing is to help individuals maintain their health so they can function in their roles. Nursing is an interpersonal process of action, reaction, interaction, and transaction. Perceptions of a nurse and a patient influence the interpersonal process.
Patient-centered care recognizes the patient or designee as the source of control and full partner in providing compassionate and coordinated care based on respect for patients' preferences. The nurse's function is to interpret information in the nursing process, to plan, implement, and evaluate nursing care.
In the first scene, even though the center of care is a patient, no one communicated with him. This is not in line to what patient-centered care is all about. There was no respect for the patient's preferences. He wasn't asked if it was okay to draw blood and wasn't given the option or explanation for the medication he was being asked to take, and nurse staff did not introduce themselves, so there was no social interaction at all. King's theory of goal attainment is centered on nurse-patient relationship and how this interaction, social, personal and interpersonal, is critical in the attainment of goal.
Teamwork and collaboration are effective functions amongst the nursing team. This involves open communication, mutual respect, and collaboration in achieving quality patient care. The nurses can use their expertise to assess the patient, create a plan to solve identified problems, and then set goals to achieve health. Ideally, the nurses and patient would collaborate in achieving the set goals, and the nurses would evaluate the effectiveness of the plan to determine if the goals had been achieved or not.
If you will recall, in the first scene, the nurse and medical staff communicated very little with the patient, Mr. Diaz. He ended up very confused and frustrated. In the retake scene, the nurse and each member of the medical team takes the time to introduce themselves, what they will be doing with an explanation, and then let Mr. Diaz know who will be seeing him next. The whole team needs to be familiar with one another's roles in order to communicate effectively with the patient. This keeps Mr. Diaz calm, allowing him to have faith in the medical team.
Evidence-based practice integrates the best current evidence with clinical expertise and patient family preferences and values for delivery of optimal healthcare. Nurses can determine what is happening to the patient, and that their support systems such as family members are able to make recommendations in terms of coping mechanisms to approach the situation. I developed a system of documentation called the Goal-Oriented Nursing Record, GONR, to complement my theory for the purpose of documenting goals and results. The nurses can utilize the GONR approach to document the efficacy of nursing care.
Recall the first scene, wherein the ER nurse did not appear to follow an evidence-based approach. She was not truly assessing the patient, was not taking any medical history, did not ask about subjective complaints. In the second scene, the nurse clearly follows EBP by taking a history, communicating with the patient, including the wife in the interview process with the patient's permission. All of these actions will result in much more effective and efficient nursing.
Quality improvement is a consistent process with different levels of nursing all working together to produce better services and care for healthcare clients. Imogene King's concept has three systems: social system, interpersonal system, and personal system. These systems contribute to quality improvement in many ways. The social system deals with religion and educating the patient. Patient education always coincides with quality improvement because it leads to better patient care outcomes and decreases the risk for readmission in the hospital.
From the time Mr. Diaz arrived at the ER up until they began treating him, the healthcare team did a bad job at communicating with the patient. The patient education was not rendered. This is an important aspect in preventing a patient from having to come back to the ER with possible admission and making the patient feel comfortable to back into the ER.
Interpersonal systems are formed when two or more individuals interact, forming dyads or triads. Triads occur when the family is involved.
When we think safety, most times we think about preventing falls, or how the healthcare staff caring for Mr. Diaz initially did not ask his name or date of birth to identify the patient. Nonetheless, safety is also educating the patient, involving the patient and family in the healthcare plan for better patient care outcomes. If you notice at the end of scene 2, the healthcare team involved the patient and his wife in the healthcare plan. This will likely cause the patient to attain the targeted goal and prevent readmission. King identified two methods for developing theory. 1. A theory can be developed and then tested in research, and 2. Research provides data from which theory may be developed. King believed that building knowledge for a complex profession such as nursing required these two strategies. Each system identifies human beings as the basic element in the system, thus the unit of analysis in the framework was human behavior in a variety of social environments. She examined multiple interactions and recorded verbal and nonverbal behaviors. Mr. and Mrs. Diaz were discharged home. They made a few lifestyle changes. Mr. Diaz is now more conscious of what he eats, his daily habits, and stress reduction techniques. Mrs. Diaz would remind him of his medications daily and importance of adhering. Mr. and Mrs. Diaz signed up a gym membership together and opted for a healthy living. In conclusion, Imogene King contributed to the advancement of nursing knowledge through the development of her conceptual system and middle-range theory of goal attainment. By focusing on the attainment of goals, or outcomes, by nurse-patient partnerships, King provided a conceptual system and middle-range theory that has demonstrated its usefulness to nurses. Nurses working in a variety of settings with patients from around the world continue to use King's work to improve the quality of patient care. King's theory of attainment has been criticized for having limited application in areas of nursing in which patients are unable to interact competently with the nurse. King maintained the broad use of the theory in most nursing situations.